Hi everybody, this is me, Barbara Martin, and I am with cow 896. 896 is not feeling very good right now. She has a twisted tummy, which is known as a DA. So we called out our vet, Alvaro. Hi Alvaro.
Hello.
You're doing what to 896 right now?
Well, what she had, what you call LDA, the abomasum, who is the fourth compartment of the stomach, displaced. It happened when the cow stopped to eat for many reasons. In this specific case, it's a fresh cow, got a dirty uterus, got an infection after calving. This is fairly normal. We try to take care of that, but sometimes the cows don't feel good and stop to eat, and because of the high quality of the feeding, lots of fermentation in the stomach, so it happens once in a while. I would say about 1 to 2% of the cows can have this problem.
And they can't just take Alka-Seltzer, can they, like we do?
Nope.
Nope.
No way.
So now you gave her a sedative, and now you're going to shave the area where you're going to work.
Shave the area, clean, and do all the cleaning before the surgery.
Okay, great. Now that Dr. Alvaro's cleaned up cow 896, you are doing what now?
This is we call the local anesthesia, blocking skin and muscles where I'm going to do the incision.
Okay. And she's remaining very comfortable.
I'm going to poke the abomasum to take all the gas who is entrapped there.
Oh.
It's fill it up with gas. So just be very careful here. Don't poke the wrong spot. Well, yeah, it goes. Yeah. It's my girl. Come on, girl. Yep. Okay, got you. And you can hear. I don't think you're gonna see, but you can hear.
Yes, I can hear it.
Okay.
So basically that's like a fart in a tube, huh?
Okay, that works.
Kids, don't try that at home.
Maybe you can try to put in a bottle too.
You know, package it.
This is methane.
Methane.
Yeah. On the membrane we surrounding the stomach, we call omentum. You just pull, and here is the stomach.
Okay, that's the stomach. Wow.
Yeah, the abomasum, the fourth, fourth compartment of the
Okay.
stomach. Just let it go a little bit down. What I'm going to do here is just to tie the omentum to the abdominal wall.
Okay.
So therefore the abomasum is not going to flip anymore.
Oh, so it won't flip anymore.
And with this technique, we always give some room for the abomasum move inside the abdomen, but always be on the right place.
In the right place. Because I imagine if they do that once, they can do it more apt to do it again.
Yeah.
And
if you don't fix the abomasum, it can happen again.
And, yes, and you don't want that. And Dr. Alvaro was saying that really they have one stomach with 4 compartments. So with the twisted tummy, it can be in any of the compartments, right? Or is it usually just the last compartment?
Just the last one, just the abomasum.
Just the, okay.
What can happen with the abomasum, he can flip to the right or left side.
Okay.
Most commonly on the left side. But when it's on the right side, then you have where to... Just a second.
No problem.
Okay, when it happens on the right side, we have the torsion or volvulus, who is a truly emergency. You have to act immediately. In a matter of hours, the cow can die.
And what are the symptoms? Is this detected? What are the symptoms for a cow having a twisted stomach?
Everything depends how fast you can notice the problem. But the diagnosis is made when you check the air entrapped on either side, right or left. Okay, but basically the cow stops to eat.
Stop eating.
Gets severely dehydrated, the eyes get sunk, many times diarrhea.
So with those symptoms...
On an RDA, this is very dramatic. The cows change in a matter of a couple hours, change badly and can die in, let's say, less than 12 hours many times.
That's why, watching our animals is so important, because it can change quickly in a very short amount of time. So after 3 layers, now you're closing up
the skin.
The skin.
Yep.
Will she be receiving antibiotics?
Oh yeah. I like to give antibiotics, not really because the surgery, but specific on her case. She had having problem with uterine infection, postpartum problem, so therefore we're going to take care of both problems.
Yes.
The uterine problem and possible infection on the site. Very, very seldom we have a problem on the surgery site, but it can happen.
Right.
We are in an open area here. We try to be the cleanest possible. We don't have any special room to do that. Nobody has this room.
No.
Not you, nobody has, because those animals they can handle on the very basic surgeries. That's not a problem. If you need a major procedure, then we can transport to a hospital and take much better care, but that's a very routine basic procedure. So
yes, like
infection very seldom we have problems.
But to be safe, because like people, we have antibiotics after ours.
Yeah, same routine. Basically, the same routine that we have with humans. They are not exactly the same drugs, but they are similar. Most of the veterinary drugs, they are not exactly the same of humans, but they have some relationship. So we have to be very careful with that. In bovine, it's not a big deal to do what I'm doing here that we call continuous suture, because cows are not going to turn around and bite the surgery site. In small animal, dogs, cats, there's no way that I can do that.
Right. And
but
I don't
in bovine, it's not a problem.
They don't need a cone like dogs or cats do. No cone.
Like that. Matter of fact, they behave much better than small animals.
After her stitching, now she gets some
This is our spray. What's gonna happen is gonna make a kind of protection film will protect the wound. So
Oh.
even if you have flies around, flies cannot go there. And
Oh.
this is gonna seal for 36 hours.
It's like a Band-Aid.
Yeah, it's a kind of Band-Aid.
Liquid Band-Aid. And there she is, our patient, resting comfortably after her procedure. And like Dr. Alvaro said, we will monitor her closely, especially for the next 72 hours, and make sure that there's no complications. And we're so grateful for the technologies and the blessings of a good veterinarian with fine skill to take care of our animals. Thanks for stopping by.